New federal data suggests America's drug epidemic has reached its deadliest height. The CDC published new data showing overdose deaths top 100,000 annually for the first time. Pfizer's vaccine data won't be public till 2076. That's because the FDA is asking a federal judge to wait 55 years. And the White House unveils peanut butter and jelly as the two turkeys set to receive presidential pardons ahead of Thanksgiving. This comes as this year's Turkey Day feast is expected to cost more than last year, partly because of supply chain issues. Tune into Deep Dive as we explore these topics and more. Hello and welcome. This is Deep Dive and I'm Tiffany Meier. A tragic milestone. President Biden on the new data from the CDC revealing over 100,000 Americans lost their lives to the overdose epidemic. That's the deadliest recorded number on record, 100,000 in 1 year. Researchers say the new record is being driven by opioid abuse. Synthetic opioids, primarily fentanyl, caused nearly 2/3 of all drug overdose deaths in the 12-month period that ended April of this year. The report found overdose deaths jumped 28.5% when compared to the same period a year earlier. Experts say there are two major factors behind the rising death toll: the virus pandemic and the fact that fentanyl use is becoming more widespread. Dr. Nora Volkel, director of the National Institute on Drug Abuse, told CNN, "What we are seeing are the effects of these patterns of crisis and the appearance of more dangerous drugs at much lower prices." Only 4 states reported death tolls lower than last year's: South Dakota, Delaware, New Jersey, and New Hampshire. Drug overdoses in the U.S. are now responsible for a similar number of deaths each year as Alzheimer's disease and diabetes, and overdoses may take even more lives. Robert Anderson from the CDC's National Center for Health Statistics said it's telling us that 2021 looks like it will be worse than 2020. And the DEA's head says the department has seen enough fentanyl to give the entire U.S. population a lethal dose. Take a listen.
DEA's fentanyl seizures this year have reached record highs. We have already seized 12,000 pounds of fentanyl. The amount of illegal fentanyl in our country has risen to an unprecedented level. This year alone, DEA has seized enough fentanyl to provide every member of the United States population with a lethal dose. And we are still seizing more fentanyl each and every day.
The director of the National Drug Control Policy also released a statement on Tuesday regarding recent participation to combat synthetic opioid trafficking from Mexico. It reads in part, the delegation discussed how the United States and Mexico are working together to reduce the production and trafficking of illicit substances. And the DOJ on September 30th announced seizures of historic amounts of deadly fentanyl-laced fake pills, including enough to kill more than 700,000 Americans during a 2-month period. DEA Administrator Milgram said at the time, during the past 8 weeks, DEA has targeted the criminal drug networks flooding the U.S. with deadly fentanyl-laced fake pills. So what can be done? In the fight against addiction, some are now choosing opioid alternatives after surgery.
It's incumbent upon us as patients to say, you know what? Not me.
Andrea Herr witnessed firsthand the toll opioid addiction can take. That's why she chose other painkillers after gallbladder surgery in March. Her procedure was done at Orlando Health. The Florida hospital has been giving patients over-the-counter pain medicine after surgery.
Their combined effect many times is just as good or even stronger than opioids alone.
Surgeon Luke Elm says a combination of acetaminophen, ibuprofen, and muscle relaxers after surgery provides pain relief without the risk of addiction or side effects.
If we give them an adequate alternative, properly educate them on the risks of opioids, and really make a concerted effort, we can really start to hopefully turn off the spigot that is the opioid crisis.
Herr says she didn't even end up using a muscle relaxer.
I managed my pain with Tylenol and ibuprofen. I knew I had surgery, but I was not suffering.
Now, speaking of opioids, let's turn to the FDA. For those wanting to know Pfizer's vaccine data, it's going to be a long wait. That's because the FDA has asked a judge to wait 55 years until 2076 to make that information public. So why the long wait? That's because the FDA has proposed to produce 500 pages per month, which, based on its calculated number of pages, would mean it would complete its production in nearly 55 years, the year 2076. The FDA's request was made in a filing as part of a Freedom of Information Act lawsuit by a medical transparency group. The government told the court it has 329,000 pages of documents responsive to the FOIA request and proposed releasing 500 pages per month to allow for redactions of exempt material. The FDA also notes in the request, quote, the acute need for transparency regarding this product is heightened by the fact that the Secretary of Health and Human Services, or HHS, the FDA's parent department, has granted Pfizer complete immunity from financial liability for any injury caused by its product. Now, some are taking issue with that. The medical transparency group, Public Health and Medical Professionals for Transparency, or PHMPT, is a group of doctors and scientists, including Harvey Risch, a professor of epidemiology at the Yale School of Public Health. They note the FDA repeatedly promised full transparency with regard to COVID-19 vaccines, including reaffirming the FDA's commitment to transparency when licensing Pfizer's COVID-19 vaccine. Aaron Siri, whose firm is representing the PHMPT in the lawsuit, wrote in a blog post that the FDA's promise of transparency is, to put it mildly, a pile of illusions. He says it took the FDA precisely 108 days from when Pfizer started producing the records for licensure to when the FDA licensed the Pfizer vaccine. Adding, taking the FDA at its word, it conducted an intense, robust, thorough, and complete review and analysis of those documents in order to assure that the Pfizer vaccine was safe and effective for licensure. While it can't conduct that intense review of Pfizer's documents in 108 days, it now asks for over 20,000 days to make these documents available to the public. The FDA did not respond to a request for comment. Now, let's turn to the upcoming holidays. The White House unveils the two turkeys to be pardoned, peanut butter and jelly. President Biden is set to pardon the two turkeys on Friday in a time-honored tradition at the White House. The birds hail from Indiana and made it in time for a press conference on Thursday to soak up the limelight. Andrea Welp, who raised the turkeys, said raising the presidential turkey flock has really been a lot of fun this year. As we all know, with another year of uncertainties with the pandemic, this project has really been something to look forward to. The pardoning tradition goes back as far as the Lincoln administration. That's according to an 1865 dispatch by White House reporter Noah Brooks. The story goes that Lincoln's young son asked his father to spare a pet turkey that was supposed to be part of their Thanksgiving dinner. The first documented turkey pardon was given by President John F. Kennedy in 1963, though it didn't catch on right away. Even though President Ford pardoned President Richard Nixon, neither one of them decided to officially pardon any turkeys. Turkey pardoning became the norm in the White House in 1989 when President George H.W. Bush revived the tradition, now a staple of the White House holiday season. Now, as for the rest of the turkeys, this year's Thanksgiving dinner is set to cost quite a bit more than usual. The average price of turkey and all the fixings is expected to be about 14% higher than last year. That's according to the Farm Bureau's 36th annual survey. The cost of the bird alone is up 24% from last year. So what's the reason for the rise? If you guessed supply chain issues, you're right, along with difficulty predicting demand because of the virus and high global demand for food, particularly meat. And now before we end, it's Mickey and Minnie Mouse's birthdays today. They both turned 93 years young on Thursday. They made their big debuts in the animated movie Steamboat Willie in New York on November 18, 1928. You can mark the day by watching a cartoon featuring the pair wearing a classic Mickey Mouse watch or t-shirt or visiting a Disney theme park. And some fun facts. Mickey and Minnie both have their own star on the Hollywood Walk of Fame. Walt Disney admitted privately in 1933 that Minnie and Mickey are married, but it's never been officially stated. Their original names were Mortimer and Minerva, and Mickey has a middle name, Theodore. Well, what do you think? Let me know below. Thanks for tuning in to Deep Dive. I'm Tiffany Meier, and see you soon.